IT band syndrome, one of the most common injuries that plagues runners, one of the most common things we see here in the office. When we think about the anatomy of it, it starts at the iliac crest, works its way all the way down to the tibia, crosses the hip and the knee. So there's a couple places for friction. What happens here is it's acted on by the TFL muscle and the glute max muscle. When knees get tight through the repetitive nature of running, it actually pulls on that IT band, causing friction down here at the knee. That tightness alone is not what necessarily causes the pain. It's the flicking back and forth when we go through the gait cycle. So when we look at actually how we're running, we push off, we come up, we have good hip drive and the knee bends, and we come back down, contact the ground, push off again, and come back up. That knee is continuing to flex and extend. At that time, the IT band is actually flipping back and forth across the lateral condyle of the femur down here. So when we come up, it's actually in front of it. As we hit about 30 degrees of knee bend, it flips to the back. We go through our gait cycle. As we come down and we straighten that leg a little bit, it flips back again, and then we take the force from the ground. One thing that people that have worked through IT band syndrome have found out is typically when you have that stabbing knee pain while you're running, once you stop and start walking, the pain tends to go away. And the reason goes back to when you're running, you're going through a much greater range of motion at the knee, whereas walking, we're just kind of striding and we never hit that 30 to 35 degree mark for that IT band to snap back and forth. If we are tight through the hip and you have friction down here, think about how many thousand steps you take per each run. That suggests people that are dealing with IT band syndrome not only roll their hip because we have to address those muscles, but to change up the surfaces you run on. If you're always pounding the pavement or you're on one side of the pavement, maybe try trails, maybe try the track. Take some of that shock out of it to help let that relax as well.